Today I will be providing trach care on a patient who has a non-disposable inner cannula. So before I came in the room, I would gather my supplies, introduce myself to the patient, identify them using 2 patient identifiers. I would explain the procedure to the patient, perform hand hygiene, privacy, and I would place a pulse ox on my patient. Before the procedure begins, I would place my patient into semi-Fowlers and I would begin to hyperoxygenate. And then before the actual trach care, we need to suction the cannula, so I have my supplies here for that. I can go ahead and open my suction catheter, and I have a bottle of sterile saline here, and I will pour some of that into the basin, and then I will don my sterile gloves. Oh. I would ensure to only touch the sterile parts of the glove and the sterile part of the package. Once my sterile gloves are donned, I can go ahead and grab my suction catheter. I will be keeping my dominant hand sterile during the suctioning procedure. And I can use my non-dominant hand. This will no longer be sterile, and I will attach to suction. And I'll set the suction to between 80 and 120. And then I will test the catheter here with my normal saline to make sure that it's patent and working. Once I determine that it is, I can remove the oxygen here, and I will begin to suction my patient. Go down till we meet resistance, and then I will apply intermittent suctioning. And once the airway's been suctioned and it's patent, I will go ahead and discard of this cannula, and also I will remove the soiled dressing. And I will discard all of this. And perform hand hygiene. And then I will reapply the oxygen while I set up my trach kit. Now I can open up my trach care kit, remove my sterile gloves, and then I will take my bottle of the sterile saline and pour into my basin. I'm going to go ahead and apply my next pair of sterile gloves, do hand hygiene again. Okay. Oh my goodness. Okay, so I'm struggling with my sterile gloves, but I would make sure to be inside of the cuff, not touching the sterile portion, the non-sterile portion of the glove with my already sterile hand. Oh boy. Okay, once we get that situated, I'm going to remove the sterile drape, and then I can place this on my patient here. And then I will put my brush into my sterile saline, get my cotton tips ready. All right, and now using my non-dominant hand, I'm going to remove the oxygen, and I'm going to unlock and remove the inner cannula, being sure to only touch the outside. Drop into my normal saline, and now I'll use the sterile brush to clean the outside and inside of the cannula, making sure to remove any secretions And then once that's clean, I can use my sterile saline again to rinse the cannula. And then I will replace. Now, while I was doing that cleaning, I would replace the oxygen on the patient to make sure that they are receiving adequate oxygenation. Now that that's placed back, I can, depending on the patient's oxygen saturation, I can also oxygenate again. Now I'm going to clean the outside of the faceplate using these cotton tipped applicators here. And I'm going to start from the outside, or doing circular motions from the inside out, removing any secretions. And then I'd make sure to get behind the faceplate here. And then I can pat dry with my sterile gauze. Then we would get our new dressing, which would normally have the slit inside of it, and we would put it up and underneath the trach there. And then if this strap were to be soiled, I would get a nursing assistant or another nurse to help me hold the trach in place while I replace it. But since it's not, we're just going to make sure that it is adequate tightness, and that would be making sure that 2 fingers can fit snugly between. And then I can re-oxygenate again after the procedure. And then other than that, I would discard my supplies, document my care, and monitor my patient.